Good evening, everyone, and welcome back to the Wellness Talks. I'm your host, Jonathan Ehrenberg. On tonight's episode, we'll be talking about the state of the mental health care system within Canada and in Nova Scotia specifically, where I'm from, a population of just under 1 million people. And so how do we deal with the influx of mental health conditions during COVID-19? And furthermore, how can we best deliver the maximized amount of service to the most amount of people? This has been a contention long before COVID came along, and now that the world is seeing a uptake in mental health cases, it has brought it to the fore. Sadly, not to the degree in which it should have, but nonetheless, we are seeing the deficiencies within our social structure because of COVID-19. And one of the biggest challenges that we face here in Nova Scotia is a two-tiered mental health care system that comprises of a public system and a private system, both of which provide excellent care with experts in their fields, well-educated and very dedicated, compassionate people. Like most systems that have anything to do with society and helping society, the people that are immersed in the battlefield, so to speak, are very passionate and are doing their best to help the people that come across their care. So with that said and out of the way, I think that I would like to offer up some potential solutions to the problem, and maybe discuss a little bit about where we need to go politically and what we need to do to strengthen our approach so that we can make the changes that we need to make. So firstly, one of the deficits of having a two-tiered mental health care system, such as a private and public one, is that you have essentially fractionated your mental health resources. And in doing so, you've severely compromised the amount of help that you're able to give. And by that I mean, for example, in the private sector, a psychologist is somewhere in the order of $190 an hour. So what the proper question here is, what are the implications of someone having to pay $190 an hour? And one of the answers is that many of us can't afford that $190 an hour, and where that puts us is in a hard spot, because that says that if you can pay, you can have your mental health looked after. And furthermore, what a private system does is that it also creates a back jam within the public system, because one, like I said, the mental health teams are essentially split up, and thus not maximized in terms of the amount of people they can help, and therefore waiting lists become outrageously long. And sometimes people go months before they're able to see anyone, whether that be a psychiatrist, a psychologist, therapist, or get into a group program that would be designed to help build skill sets to, for example, manage anxiety better. So this is one of the biggest problems that we face, is that this system is just so broken. And one of my biggest concerns about having this broken system is that it's, whether intentional or not, is divisive by its nature. So the further down the socioeconomic ladder you go, or the cultural ladder, your chances of getting access to care decreases, because, like I said before, many of us cannot afford that $190 an hour, And, there are such things as mental health crisis. So, in other words, how do we manage that? Like, if you have to have people in a scenario where they have to wait several months to get care, there's a good swath of the people who have mental health conditions who simply aren't able to wait that long. And so the question becomes is how do we get the biggest bang for our buck and help the maximum amount of people? And my potential solutions that I would like to put forth are twofold. One, your options are to forego the private section and amalgamate them into a robust public mental health care system where you have your resources all concentrating their efforts and their expertise in the direction that best serves the country, the nation, the world as a whole. And that would alleviate division from this perspective. And in this day and age where we're working so hard to minimize division and to do our best to treat everyone with dignity and respect that they deserve, having a two-tiered semi-private healthcare system of any kind, whether it be health in general or mental health care, does just that. It creates division. And so the other solution that we could do, and would probably be easier from a policy point of view, is to do a scenario whereas, yes, you have equal access to the system, but what happens is that the government subsidizes the $190 an hour for people to get the help they need. This, to me, doesn't seem unreasonable when you look at it from the guise of total care for everyone. And while we can sit here and discuss this in great length as to what would be best, those are certainly things that I think could contribute to the workload and focus on the epidemic that is mental health concerns in the COVID-19 era. And the biggest obstacle to this is, of course, the politicians in the political parties, or more specifically, the sitting government at the time. While we recognize that COVID-19 is an absolute emergency of epic proportions and could impact humanity as a whole to a degree which would be catastrophic, mental health all over the world has gone up exponentially, and one of the things that we really need to address, and it's more like the elephant in the room, is that crisis, that mental health crisis. And so what are the implications if we refuse to take it on with the ferocity that it deserves? And one of those things is that, of course, we could end up losing a lot of lives, and that further fractures families and friends and close relationships and social situations, employment. And then you get into the just actual economic impact of refusing to look after, to reinvest in your mental health care system. And back in 2011, a report was released. You'll have to forgive me, I forget the name of the report. But if you look through my blog posts, you'll find it there, and I'll post it down below. But as of 2011, Canada spent $50 billion on mental health care alone. And that's downtime. That's not expenditures, investment into the system. That's, people with depression taking sick days, and people, going off on disability because of post-traumatic stress, for example, or something. So it's estimated that if we put a fraction of that money and invested it into mental health care, the return would be a reduction in that $50 billion. And remember, 2011 wasn't yesterday. So presumably the numbers are higher. And it's not a stretch to think that because of COVID-19 and the raising rates of mental health conditions, that those numbers, those economic numbers, 50 billion, are probably quite a bit higher. So there's a lot at stake by simply brushing mental health off to the side and hoping that people, I don't know, get through it, I guess, on their own. I know that something needs to be done, and we need to bring it to the attention of the political parties. In our country here, the only party that really has it on the radar with any amount of significance is the New Democratic Party here. That is one of their mandates. While my opinion on the matter is that all politicians, federal and provincial and municipal, should put it on the docket as a priority. And so in other words, a lot of our social issues are very important, but right now, if you looked at it from a triage perspective, it's sort of like COVID, healthcare, mental health care. Again, these are my views, and I express them, and I know that not everybody will share them, and that's fine. But when you look at it from a triage point of view, you look at it and say, well, where's the emergencies? What needs to be tended to first? And when you're looking at social systems from where I sit, you need to look at it from the guise of where you can get, where you can have the most effect on the most amount of people. And certainly that takes investment, and that takes eliminating the barriers around access to care, whether that be long-term care, health care, or mental health care. If there's barriers in place, thousands to millions of people could potentially go without. So those are, or should be, ringing alarm bells in every political corridor in every country that's facing similar challenges when it comes to mental health. This is really something that's being underestimated, I think, and I think that it's incumbent on us to make sure that we are able to bring it to the forefront and to have it brought to the attention of the politicians and the media or whoever. Because what happens is that when you have, obviously, if you don't have the money, you can't get in to see a psychologist for $190 an hour. And furthermore, if you really need help because you're in a crisis, there are crisis teams and things. So that's wonderful. And most mental health organizations that are publicly run will have the emergency crisis response team number on their website. So check that out depending on what region you live in. And those are wonderful things. And again, but there's a resource issue there. So, for example, I don't believe that there's much of a push for to have psychologists or anything like that of the private sector, and I could be wrong. Last time I checked, there wasn't really a whole lot in terms of the private sector contributing to those emergency teams, but hopefully we can change that narrative by amalgamating everything, and we could have more psychiatrists doing rounds in hospitals and things like that. So there's the refusal or to deal with mental health care and to not fully evaluate the consequences of having a two-tiered mental health care system. In my view, the repercussions of that are really significant. And because, like I just said, from anything from having a lack of psychiatrists to do rounds in hospitals or to provide emergency intervention, to the inaccessibility depending on your cultural, socioeconomic situation, and so essentially, and the refusal of government to actually say, whoa, we need to slow the bus down here, and we need to dump money into this. When it comes to social systems, cutbacks are not the answer. And that's because when you're helping people, you can't claw that back. There's just no way you can claw that back. If you had $100 and took it out of your budget, you would sadly not gain anything. I suppose you could put it on your mortgage, but that's a moot point when you have to eat. So in these things that we go through in terms of social systems, we have to have, right? The only difference in our societies is to say, well, it doesn't matter what the scenario is, somebody's entitled to make money from it, whether it be healthcare or manufacturing or any of those things, private long-term care facilities. So that's the real issue when it comes to taking care of people, is to say that there needs to be that it's okay to have a profit attached to that. And in my view, we're seeing the results of that through this two-tiered mental health care system, through the clawbacks of the public healthcare system. And we need to do better, and we can do better, because we all have sons and daughters and aunts and uncles and all kinds of people that deserve that care. We all know someone who's suffering from a mental illness, that's having a hard go, that's really needs to have that access, and to be denied because you don't have $190 an hour, or because the system is fractured into two different groups and there's not enough resources to help you get the access you need, even though it's paid by public dollars. It's well, in my view, it's inhumane. And I think that it's time that we brought it to the attention of the governments and the political parties, and have people write their MLAs and write their MPs and write the Prime Minister of Canada, or if you're in a different country, write your political leadership, and do so not with a few people, but do it en masse. Organize. We simply, because our lives depend on it. Somebody's life somewhere depends on it. We'll spend an untold amount of fortune on policing, and I fully support policing, but at the same time, there doesn't seem to be we really need to slash and burn that whole system. But there seems to be, when it comes to solely helping people with their illness, it kind of takes a lower priority, and this day and age, we can ill afford to do that. So with all that said, I think we'll leave it there for today, and I want to take the time to thank everyone for joining us at the Wellness Talks. I appreciate your support, and we can't do this without you. And if you have any questions or comments, please feel free to write us. Right now, you can write us at the Road to Mental You can write us at roadtomentalwellness@gmail.com. And please don't forget to check out the roadtomentalwellness.com, which has got a lot of good quality content that may help inspire. That's the whole intention, is to help inspire people to get the help they need, or to help someone else that's in need, or to create social networking with like-minded people so that they can lean on each other and get through things. So in that respect, I think that we could all help each other out until we're able to fully fund a public healthcare system, mental health care system, that does what it's supposed to do: help those who can't help themselves. So without further ado, I would like to say good night to you all, and please take care. Bye-bye.